Welcome to Against the Odds. Everyone has a story. What's yours? Sharing your story can inspire and ultimately transform lives.
Hello and welcome to another edition of Against the Odds, a show where we believe that sharing information can inspire and can also transform. Today, I have the singular honor of welcoming Dr. Catharine Nformangum to the show. Welcome.
Thank you.
And as you know, if you have been watching this show, you know that the questions are not scripted. We'll just ask and answer as I'll get the questions from answers she provides. So, could you please tell us a little bit, just a little bit about yourself?
Okay. Anyway, yeah, you called me doctor, and I'm gonna take this opportunity to make that a little correction. I'm a doctor because I treat, people.
Okay.
But professionally, academically, I'm a nurse practitioner.
Okay.
Yeah, family nurse practitioner. You could call me a primary care provider.
Okay.
Okay. So
I don't know how I got that mixed up, but that's okay.
yeah.
Thank you
So a
for
lot of
pointing
people
that
call
out.
me, doctor, because I happen to be, have run a family practice clinic in Houston for a very long time.
Okay.
And so most of my people in our community, they call me doctor.
And that's how I got to calling you doctor.
Yes.
Because a few weeks ago when we had on vacation and somebody introduced me to you, right, Dr. Catharine.
Yeah.
Okay.
So that's how doctor came about.
I see.
Yeah, but I'm not a medical doctor. I'm a nurse
I see.
practitioner.
Okay.
Yeah.
Well, that's cool. Your name, Nformangum. Now, I grew up with my grandmother in Jong, and in Jong, for is chief.
Chief.
So you're from Mangum. Are you the chief of Mangum?
Well, Mangum. What is Mangum? So to
Mangum, like
Mangum,
Okay.
or it could be Mangum, drums.
be Mangum. Yeah.
Yeah.
Okay.
Yeah.
Okay.
So it could be drums.
Mangum.
Yeah.
Now I see. I didn't think about that. I only thought one way, like, okay.
Yeah, so it could be drums, and I take it to the drums because I happen to be a drummer.
Cool.
So that name,
You mean what kind of drumming? Like,
the African tam tam.
Okay.
Yeah. So I played drums when I was a young girl through my young adult life. Yeah. Here we don't have African drums here, so I don't play a lot of drums.
I have some.
Oh, you do?
I have some upstairs.
Okay. Yeah, so I'm gonna play some drums today.
Cool.
So I'm probably gonna earn my name for
All
me.
right. So you're Nformangum, like chief drummer?
Well, that's what you could say the name means.
Okay.
Yeah.
So, a few weeks ago, I saw a clip that you made talking about prostate. But before we get to that, how was growing up?
Growing up back home,
Yes.
I'm gonna say home
Of course, home.
because I'm not gonna say come.
Absolutely.
Anyway, it was awesome. Yeah, they. I grew up in the village. Yeah, and I got myself very connected to nature, and I was very observant. So I think I'm authority sometimes when I say I know about the African culture and our people, our way of life and stuff like that, because I have always been very observant, as a kid. And I remember one of my dad's friend, when he first visited the house, and saw me, he came to buy coffee. because my father would do nursery. He nurses plants. He went to the School of Agriculture. So he came to buy those plants, to go and plant. And I counted the 100. I think I was maybe 9 years old, so I counted everything like I was supposed to. And so he told my dad, "This here picking, no play with that." So, yeah, I'm very observant. I was very connected to the people, to our people growing up. I was not. My head was on the ground. My ears were on the ground. I was always attentive to everything, that is happening. And I think it's that, upbringing that has helped me, in my life.
Okay.
Yeah. Staying focused, staying connected, and just always being grounded.
Okay.
Yeah.
Large family?
Yeah, 8.
8.
Yeah, I'm the second of 8 children.
Okay. That's cool. So what drove you into the medical field?
What drove me into the medical field? Because it was a big drive, right? It's a big shift from law to
You did law?
Yeah, back there, yeah. And then when I came here, of course, when I got here, the law degree, as had to, you have to switch, or no, not switch. You have to go back to school in Texas, or you take the New York bar or the California bar. And so I'm like, okay, that's gonna take me a long time. And I don't want to live in New York. I don't want to live in California. But then I became a CNA. Yeah. So working as a CNA in the hospital, I realized that I was a caregiver. I just had, I connect with people, I connect with people in ways that, most of my colleagues, appreciated it. And so because of that, I was like, okay, I could do this thing. I could become, a healthcare provider. So that's how I took the route to become.
All right. So back to the video you posted. I watched it and I was intrigued. Because that's not something most men or most Africans, most Cameroonians think about.
Or even know about.
Or know about. Well, I had an idea. I know the thing I knew about prostate is that I have to test every year above 40. Okay. That was it.
Okay.
So your post got me to thinking. And I said, okay, if this is not something that I think about often, maybe most of my colleagues don't think about it. And I thought it would be a good idea for you to come on and share some insights.
Yeah. So, well, that post, actually came, I was coming from a place of, grief. But then I said, let me use this opportunity. They said, let not his life go in vain. So it was time to say something so that somebody else or another brother, don't go the way he went. The friend from whose funeral I came from. It was a Saturday. I think, no, was it a Friday? Yeah, it was a Saturday. So we had that wake on Saturday, and then on Monday, I was like, you know what, let me say something about this issue. So like you said, a lot of your brothers or your friends don't talk about it. Some don't even know about it. Yeah, I've had someone ask me, what is a prostate? Because I'm reading results. I'm like, okay, your prostate was good. It's like, what is prostate? So
Okay. Yeah.
that was a man.
Okay.
Yeah, so some don't even know, about it. So like you said, rightly said, it's every year. And I think one of the reasons that a lot of Africans don't know about prostate is because issues that have to do with, the genitalia and stuff like that, they're kind of off limits. Yeah, your father did not talk about it, so you're not gonna hear about it. You went to school. If you didn't study medicine, that was not in the curriculum. So you could go, your whole life, and not know it. Women know about the breast cancer. The breast is obvious. The prostate is not. So if somebody has not told you, about the prostate, you could live your whole life and not hear about it. Or, yeah, if you have left Africa where you had the opportunity to maybe interact with people, and then you come to America. A lot of us in this country, we just work, and if you don't go to that path where somebody is talking about health, you could actually just live the rest of your life, as an African, without knowing what a prostate is, without even knowing you have one and how to take care of it.
So what is it?
Yeah. So the prostate is a little organ. I'm just going to be very simple.
Okay.
That sits, around your rectum. Yeah, and helps with, fertility, store sperms, help with sperm production, and stuff like that. And then because it's an organ of its own, it could become cancerous. You could develop cancer. And it happens to be one of the cancer that is very prevalent in black men. And like I said in the video, it's not that it's prevalent in black men. It's that black men die of it more than every other race. And you know the obvious why, because they don't know they have it. They don't know they have the prostate. They don't know what to do with it. They don't know they should check it. And so most of the time, by the time they find out that something is wrong with the prostate, it's almost late, and that is usually the case with most cancers, because cancer doesn't hurt until the terminal stage, yeah. So by the time you're having symptoms, it's almost over, yeah. And so that's the thing with prostate. And then the symptoms of prostate could mimic a lot of things. Yeah, it could mimic a lot of things. It start off, men would think, okay, I'm just growing old. Your stream, your urine stream becomes very, weak.
Yeah.
You don't shoot like you should be, like you did before. Now your urine is dropping, and you just think it's part of aging. Yeah, and there's no pain, so why worry? So, and most of the time, men, they kind of get into a very in the slow depressed mood, to okay, what is going on with me, and then they bounce back, just like every other disease. You have a very subtle symptom, something so minute that calls your attention to it, but then it goes away, and then you move on with your life. But it's steadily, growing. So back to the prostate, like you said, men should check their, every year. You said from the age of 40.
Right.
That also depends on your family history. So if, let's say your dad was diagnosed with prostate cancer at the age of 40, you shouldn't wait. You should start really testing at the age of 20 or 30. You understand? Yeah, if you have a parent or a family member that was diagnosed at an earlier age, your testing should be earlier than 40.
So, but okay, we're looking at the context of maybe the Western world, in cases back in Cameroon where maybe the tests are not prevalent and people may die of it without actually knowing the cause of death. How do the children, how do the offspring know that my father, my uncle, whatever, died of prostate and to go check?
Yeah, the issue with Africa is not that these things are not available in Africa, is that to be blunt, health is not a priority. Yeah. In Africa, people are just really struggling to eat. It's only after you've ate that thinking about your prostate is the next thing. If you haven't fed yourself, you're not thinking about those things. And then secondly, I also happen to have gone home and did a health screening to understand how the healthcare system works back home. There's something that we have back home that is very, very good, but we take it for granted. The hospital book. That's your medical record. You understand? When I take the medical record of most of our people, they have, like men, they have checked their prostate. Yeah, when they have gone to the hospital for whatever, the only issue is the healthcare providers back home don't talk to the patients. They don't tell you what they did, why they did it. You understand? They just look at the record and say, okay, they found this. They write something down, they scribble stuff, hand you the book, and you take to the pharmacy, and then you pick up your medicine. But you 90% of the time, you don't know why you're taking it. Yeah. So you come in, and I also happen to have been to the hospital back home after I came here and went back home. I did that to understand the system, right? So you go in, I took my daughter, and the consulting nurse, I just told her what the symptoms were, and she's writing. She's writing. As she's done writing, she handed me the book. That's it. She didn't ask me anything. She didn't tell me anything. I was supposed to just take that book and go to the pharmacy. Her diagnosis was on point, but she didn't tell me what it was. You understand? I knew, what it was. I knew those things. I could have gone to the pharmacy to just pick up the medicine and stuff like that, but I had to give credit to the system, right? So 90% of the time, it is not that these things are not there, it's that they're not talked about. Even the healthcare providers themselves, there's lack of education. There's zero to no education, to no health education. Yeah, from the parents to the children, and then not even from the healthcare providers themselves. Yeah, I don't know if it's the culture, plus they're busy, but that should not be. Yeah, so, when you look at that hospital book, you see what they've done. Most of the time, what they've done is what I would do. Yeah, so the healthcare system, and that is something I try to make sure people understand and don't take the healthcare system back home for granted and think it's better here than back home. It's not, that's not the case. The only issue that I see from my experience is lack of education. Yeah. Or, for example, I had this other lady during my health screening. Yeah, she came to me for blood pressure. Mm-hmm. She had a stroke. She was given blood pressure medication. After the stroke, they treated her, put her on blood pressure medicine. She took the blood pressure medication that she picked up from the, what they call dispensary, from the pharmacy, and that was it. Then when they were finished, she moved on with her life. Nobody told her you have to come every month, you have to come you understand? We're treating you for blood pressure. Blood pressure is not a headache that will go away, after you take this medicine for 1 month, it will go away. Mm-hmm. So those are the things that are lacking. That's the number one thing that I believe, if we can fix it. You understand? Yeah. If I can just have the healthcare providers just talk to the patient like, okay, mommy, you get blood pressure. You take the medicine. Go chop. Can't see me. come back next month or come back in, whatever. I mean, if you give 90 days supply, come back in 3 months, or stuff like that. And then one other thing that, I have noticed, I'm working with another pharmacist from home. We're here trying to set up something where we could have, stuff available for people back home. I think another thing is also that when they take those medications and they finish, some of them know they should go back, but they don't have the money or the time or something. And so you also have people in the neighborhood selling cassava in the form of medications, and they take them to these people, to our mothers to buy. And basically they're not taking their medication because what they're taking is not it's not the medicine. Yeah. So did I digress too much?
No, I mean, you're on point. So I'm sitting here thinking, how can we overcome that problem? How can that be?
I think, I don't know if we should empower the population, or I don't know what needs to be done. Empower the population, or just tell them when you go to the doctor and they write you that thing and hand you that book, that's your health. The only people talking is the doctor and the pharmacist. That's who knows what is going on. You don't have a clue. It's your health. And you went and you spoke to this person, they wrote something, go for lab, you did lab, didn't know why they were doing the lab, you came back, the doctor read it, scribble stuff, take and go for dispensary, you went there, you took medicine, you went home, you don't have a clue. So when you call them, you talk to someone back home, they have an illness, what did he do you in a fever? What is fever? You understand? So you left the house because you had fever, but you went to the clinic or to the hospital, wherever you went. They diagnosed you with something, and you took medicine for that thing, but you don't know what it was. Yeah. And so is that gonna take me to another big problem that affects our people, And so let's say this lady, the one that had a stroke, so she's back to me. I be go farm, I dey for farm, I fall na for farm, they can't take me. Okay, treat you, give you blood pressure medicine, but you're not taking it. You have that blood pressure. Came to me, blood pressure was sky high. And I'm looking at her book, I can see that she's been diagnosed with hypertension and she was prescribed medicine, but she never went back. Nobody told her she had to come back. You understand? Okay, and so now she's hypertensive. Now it is assumed that her kids or her siblings would have hypertension, right? Then they too have a stroke, because they've become hypertensive just like her. They had a stroke. So now that family get bad luck. You understand? Yeah.
Okay.
So little things like that, they don't have to be big, just very minute things that could help our people and save a lot of lives. Yeah, it's just education. Yeah.
So folks, again, this is Against the Odds. We're sharing stories, and this is one of the reasons why we're doing this, in hoping that somebody out there would listen to this and talk to somebody who talks to somebody at home to help ameliorate this situation.
Yeah.
Okay. Back to prostate cancer and our country people. When I listened to your post, you made a statement that just tickled me. I just laughed. And you say they like jiga if you move up. All right.
Yeah.
So could you elaborate that jiga palabra?
Yeah. So, you know, sometimes when people think they could have something, they could have an illness, most of the time they're not proactive. They're scared. They don't want to find out. Because if they find out, then it could mean the worst. And then that particular mindset drives them further into doing reckless things with their health. You understand? And so prostate cancer happens to be one of the most easily treated. Yeah, you know, because the prostate is right there. It's like some small jiga. You know, you just go carve it, you know, take it out. You understand? And yeah, and so when you know that what you might have is not a death sentence, it's something that could be easily treated, you are motivated to go check, you know, to go check it out and nip it in the bud. So that was, to me, that was I was trying to pass the message that it is not as bad, you know, as you think. First of all, for those who don't know about it, who don't know they have a prostate and what to do with it, to go get, you know, first of all, go get it, know that you have it, know where it is and what could happen to it, and then go get it checked once a year. And so you get your prostate checked every year, and your PCP, your doctor. I'm a PCP. You know, I have a clinic. My clinic is about maybe 15 minutes from here.
Okay.
Yeah. So yeah, you go get your prostate checked, and then they monitor your PSA, which is it's called PSA is prostate specific antigen, which means when your prostate is overacting, it's gonna release that specific antigen to your bloodstream. And so when they check your blood, they would see it, right? And monitor it. Sometimes it's not even that you have cancer, it's just that your prostate, with age, they call it a growing problem. That's what causes weak stream, you know, for men, and because now the urethra, because it has grown and it's now, you know, pressing on the urethra. Yeah, and so your urine stream is a little bit weak. Or you could have, you know, urinary urgency. You pee a lot at night. You get up at night to pee and stuff like that. So at that time, if your PSA is a little elevated, it's not because you have cancer. It's because your prostate is growing. It's getting larger. It gets larger with age. Yeah. So then there's medicine to stop that from growing. You know, to arrest that growth, to prevent it from overgrowing. That overgrowth is what could lead to the cancer. Yeah. Mm-hmm.
So let me understand you well. A symptom or simple symptom will just be the stream or the urine. Mm-hmm. So if it's getting weaker, that could be a cause for concern, which should prompt you to take action.
To take action. Mm-hmm.
Is there anything else that?
Another one is getting up at night. Yeah.
Is it only at night?
Yeah, getting up at night to urinate.
Okay, but
yeah,
during the day.
During the day,
if you urinate a lot.
And during the day, if you're urinating a lot.
Okay.
You know, if you're urinating a lot, it could also mean, you know, something is wrong with your prostate, or it could also mean diabetes. Yeah, because diabetes comes with, you know, urine. Your kidneys are trying to flush out the sugar, so you're peeing a lot. Mm-hmm. So yeah.
That's what I was going to come to, because I'm diabetic, so I could relate to that.
Okay. Yeah.
So, number one, stream. Number two, a lot of urinating.
Yeah.
Is there something else?
Yeah, you could have some, you know, burning pain when you urinate. Yeah, you could have a burning pain, when you urinate also. Yeah, the little stingy pain. You could feel that also.
I did not know about the PSA test.
Okay.
So prior to moving here, I was in Michigan, and every year my doctor used to make an exam thing. It used to be DFT or whatever.
Digital rectal.
Exactly. So he used to do that every year. Okay, so when I moved here, and I've been seeing my doctor for 4 years, I didn't have that done.
The digital rectal exam.
Exactly. So now I went and asked, I said, but what's going on?
Good
So
for
I'm
you.
about 40.
Yeah.
I've not had this done. And she's like, well,
No, I've been doing your
I've
blood.
been doing it. I've
Yeah.
been doing your blood.
Yeah.
PSA. I said, oh, okay. So you out there, if you've not been doing any tests, PSA, if you don't know about your results, or if you have your results, check for PSA and see.
Yeah. Yeah.
So